And welcome to Sugar Talk with Dr. KJ Lucas from Diabetes and Endocrinology Consultants. Good morning and Happy New Year, too, by
Good
the way.
morning. Happy New Year.
And you brought along a guest, I see.
This is Lucy the lab rat
Uh-huh.
to talk about research today.
Right, and so you have a visual here.
A visual
hand
for
puppet.
people on the radio.
Yes. All right. All right, so what does Lucy want to tell us today?
Lucy wants to say that people that participate in clinical research are not lab rats.
All right, well, good. Well, that's a good subject because you do a lot of research or you participate in a lot of programs. So, let's start off with the obvious question. Why should somebody sign up for that?
Well, we do a lot of diabetes research. So diabetes is different. It's a chronic disease. You want to pay attention to it more. People sort of forget, to do it. But in a research program, pretty much you're provided with the tools to check your blood sugar more often. There's more accountability. You come more often to the doctor to go over the blood sugar readings and talk about diet and talk about things you can do to lower your blood sugar. So it really does help your diabetes get better controlled, even if you're not on the real study medicine. If you're on the placebo, that's why they have a placebo, which is sort of it's a practice medicine. It's
Sure.
not the real medicine. It's just it's a fake medicine. So some people get on the fake medicine because they do just as well as some of the people on the drug, depending on how well they do in a study, depending on how much they're paying attention to their diabetes. So for diabetes, being in a clinical research program is actually trying to get your diabetes better controlled in general, not just trying out a new medication.
So for many, just participating in the program, they will pay more attention.
Yeah, it helps them, and there's no cost in the program. You actually get paid per visit depending on the study. You get a stipend for travel during the study, and all your supplies, your blood sugar strips are provided, any kind of study medications provided, lab work, physical exams, all that is provided by the sponsor of the study. So that's a good deal for a lot of people, especially with insurance copays going up, and people without insurance a lot of times get a lot of benefit out of these programs. But it's not just for people without insurance. We don't bill insurance because the sponsor's covering the costs of the study. But you can also try out new medications. I mean, there's a lot of new diabetes medicines being developed that are better than the ones. We've had a progression of improvements in diabetes medications over the years, where they're actually targeting specific defects in the regulation of insulin production. So a lot of those do not cause weight gain. They help you lose weight. They help you be less hungry, help your sugar not swing up and down. So a lot of the new medications are better than the old medications for diabetes.
So if somebody was on one of the programs and they were doing very, very well, can they stay on that medicine, or how does that work?
Well, most of the medicines are not approved yet,
Right.
So you can't. Although trying out the medicine over 6 months to a year is not bad, and then when the medicine does get approved, you know that you did well in that kind of medicine. There's also other medicines that are already approved that are on the market that are similar to the medication in the study, so that a lot of times that helps you decide whether that kind of medicine is right for you or not.
You may not know going into the study that this sort of version of diabetes medicine might help you.
Right, you may not know. Sometimes you do know you're on the study drug because of side effects that are common with the study drug versus the placebo, but some people don't. Everybody thinks they're on placebo in some of our studies because there's not that many side effects with the newer medicine. So everybody thinks they're on placebo, but their sugars get better, so we don't know.
Now, does everyone who is diabetic, do they automatically qualify for a study of some sort, or do they have to go through a review process?
Yeah, there's rules. There's rules for each study. There's qualification rules. So usually A1C. A1C is the biggest one. They want people that are not perfect, which includes almost everybody, so it's okay. But usually the A1C needs to be 7 or more. We have one study starting out that will actually go down to a 6.5, to start with. So some of the studies, 6.5 is a really good A1C. But most of the studies want your sugar to be a little bit high so that they can prove that their drug actually works and lowers it.
So you have, if somebody passes the first stage or whatever, they have a workup to determine their A1C?
Yes, they'll have a lab work done, they'll have a physical exam, they'll have to answer some questions. Some studies don't want you on certain medicines, or they want you on specific medications for studies. And so we have to go over that and list of medicines and list of previous medical problems and things that may prevent you from being in a study.
If somebody's diabetes is not well controlled because their own bad habits about keeping watch on it, does that help in a study? Or I mean, does that tell you anything?
Well, that helps you qualify because your sugar's not controlled.
Right, right. So
when you're in the study, usually try a little bit harder because you're given the tools to try harder. You're given the strips and medication to see if your sugar will get better controlled. And then you're also being watched by people. I mean, the study staff is like your own private medical office. They take care of you really well. And so they call you a lot during the study, and you can call them anytime. It's your own private concierge medicine practice, practically, that you don't pay for. So it's a good deal for everybody. It's a good deal because you're giving information that helps future generations with diabetes medications getting approved or not getting approved. If you have side effects from that medicine, we report everything that happens so that you have some input into what gets approved and how it gets approved.
Do people often have that kind of altruistic attitude that they're going to help out some others too?
Yeah, I think that's part of it. I think that's why people want to volunteer for research, is to help other people. They have diabetes, and they would like other people to have an easier go of it, especially their family, because it's a genetic disease. So if you're doing something now to help out, then hopefully the new drugs in the future will help future generations. Future generations of people with diabetes, because it's not all just because you eat bad that you get diabetes. It's a genetic predisposition to get it.
Now, in your studies, mostly you're on a certain track of studies, right? I mean, you're not at either the very beginning or the tail end, or where
there's a recruitment phase for any study. So once they get their number of people that they need, they'll stop recruiting for that study, and then we'll just follow those people along. Studies last some studies last 5 to 8 years, depending on what kind of study it is. Other studies last 3 months, 6 months, 1 year. So you'll know at the first what you're expected to do. The consent form is very detailed on everything that's in that happens in the study.
Okay, all right. We'll have more to come in just a moment. Again, if you want to find out more about diabetes and endocrinology consultants, you can go online at beachdoctor.com, and they bring you Sugar Talk every Monday morning here on the Talk Station. And Lily's attacking the microphone now. We'll have more to come in a moment here on Coastal Daybreak on the Talk Station. And welcome back to Sugar Talk with Dr. K. Jean Lucas, brought to you by Diabetes and Endocrinology Consultants. And Doctor, we're talking about studies. What does somebody have to do to get started if they want to be considered for one?
Well, they can go to the website, beachdoctor.com, or they can call our office, and we ask them a few questions. They also have a questionnaire online at beachdoctor.com that they can fill out, and that goes to me, and I review it, and we sort of see what kind of study they might get into. And we take people, even if they don't qualify for a study right that minute, if we think we can work with them and change things around a little bit so they could qualify for a study, we'll do that for a while before they get into a study. So if you don't exactly qualify perfectly, then maybe we need to work on some things, and like if the blood sugar is too high, or now if the blood sugar is too low, you probably don't qualify. People say, well, I can get it higher, and I'm like, no, that's okay.
No, we don't need to do that.
But for right now, we have 2 and a third type 1 diabetes study. Those are for people on insulin. They have to take insulin. And we have type 2 studies that are either on no medicine, one medicine, metformin only, or metformin plus, like Amaryl or glipizide. We have people for that. Those types of drugs that we have for the type 2 studies would be like Victoza, that are oral, which would be a big advance. There's SGL2 inhibitors, which are the ones that pull sugar out of your body. There's several studies with that. There's some other weekly injections that are not like any other medicine on the market now. So those are the types of studies we have now. We also have a heart disease weight loss study. It's for people that have had a heart attack or stroke. All the weight loss drugs and diabetes drugs have to do this. They have to take people that have had heart disease and prove that they don't cause worsening of the heart disease. So that drug is Contrave. That's already been approved. It's just they have to do a long-term study with it. So that'll start in March.
Now, do you ever have studies that are specific for men or women, or for different demographics? Or?
We have a male study with testosterone coming up, oral testosterone. So most testosterone is given by shots or gels or patches. And this one will be an oral one, so that'll be males only, of course.
Okay. But how about age groups? Do you ever do one that are either younger or older?
You have to be over 18
right.
to be in a study, in an adult study. And the age cutoff in the upper range has actually changed. So now a lot of times there's no upper range. Sometimes there's age 75 is the upper range. It just varies from different studies.
All right, and what is the number to reach you there at the office?
It'll be 222-5700.
222-5700, and you can also find it at beachdoctor.com for diabetes and endocrinology consultants, and we'll see you next week on Sugar Talk.
Thanks.